Good evening, dear students. I hope you can see my screen. I'm audible. Please let me know. Please let me know if I'm audible. You can see my screen. I'm Dr. Pawan Kulkarni. First of all, I want to wish you all the best for your upcoming INICET examination. Today I'm here to give you an overview of. I'm not going to teach you anything here today in this 1 hour. It's not possible. But here, the main intention of today's session would be to highlight and give you an insight of what next in this few hours you have to prepare. What you're supposed to prepare, what could be the most commonly asked questions, what will be the things that will be asked, all those things I'm going to cover here. So here, let me start with the first topic here, developmental disorders. All of us know in INICET, usually the questions or the MCQs, there are certain favorite topics for the examiner. One of them being genetic aspects. All of us should be now aware of, or all of you might be knowing, we have already discussed that during our classes, genetic aspects. Genes involved in different conditions and diseases involving the oral cavity is one of the favorite topic for the examiners. So genetic aspect, like for example, I'll give an example. Pleomorphic adenoma is associated with the mutation of which gene? PLAG1 gene. Okay, like that. For example, TCOF1 gene is involved with mutation of TCOF1 gene is involved with which of the following syndromes? Treacher-Collins syndrome. So I'm just giving an example. I'm not teaching you anything here. So genetic aspect, now make sure you will get you'll revise that. Okay, whatever the diseases, what genes are involved. You need not go into much more details like that gene is located on which chromosome, what is the which arm, and all those things usually they'll not ask. Most commonly will be your genes involved. Okay, so that's the first thing. And then you are supposed to know about syndromes. Syndromes in the oral cavity, involving the oral cavity, is again a very favorite topic. Syndromes. So you let it be any kind of syndrome, let it involving any chapter. Let it be bone, let it be skin, let it developmental disorder, whatever is that, salivary glands, whatever syndromes, all of us, we have to give emphasis to the syndromes now when you're revising. So I'm telling you what all you need to revise now immediately. So genetic aspect is over, syndromes is over. You need to go through syndromes. So syndromes, give attention, give emphasis to the images. So like for example, if they can give you an image of they can give you an image of Treacher-Collins syndrome. They can give you an image of Treacher-Collins syndrome, and they can ask you like what kind of syndrome it is, or they can give you an example of any kind of Pierre-Robin sequence, whatever is that. So they can give you an image, and and related to that image there can be an MCQ. Okay, so you should understand in a syndrome what is expected is you should know about the diagrams, images, and the important components of the syndrome. Like for example, if I'm talking about Pierre-Robin sequence, Pierre-Robin syndrome, I am supposed to know that there is micrognathia, there is glossoptosis, there is cleft palate. So they can give you an image, something related to that. So I should know the image, I should understand the image, I should understand the components. That is about the syndrome. Okay, so genetic aspect is over. syndromes is over. Now next what? Again, the favorite area of the in INICET is your whether it is autosomal recessive, whether it is X-linked, whether it is autosomal dominant. That again inheritance pattern, that is called as inheritance pattern. That is also very commonly asked. So in our theory classes, in our classes, in our discussion, in our session, we have discussed in detail. There are n number of diseases in oral cavity with inheritance pattern. So specific diseases they will ask. Like for example, cherubism, autosomal dominant. We're supposed to know that. Autosomal dominant. Specific diseases are like skin disease is there, ectodermal dysplasia, which is X-linked recessive. They will ask you that. Okay, so specific disorder are usually commonly asked. X-linked recessive disorder. Okay, so X-linked dominant are very rare. Usually they'll ask you autosomal dominant or X-linked recessive. Sometimes autosomal recessive is also asked. X-linked dominant is not asked. So you are supposed to know all those that list what is common. List you need not by heart the list which are very rare. They won't ask you rare things. They common things. These like for example, cherubism inheritance pattern is autosomal dominant. That is one kind of question you can expect there. Okay, so that is about the inheritance pattern. Now moving on to the most important thing in oral pathology. What is that? They'll ask you about the histopathology. They will give you histopathology images. They will give you histopathology images. Very commonly, we have discussed in detail. All histopathological images are very favorite here. Okay, for the examiner. Again here, the histopathology, you might ask, what is the histopathological image like? What we need to read, what we need to see. Usually, histopathological images are either picked from odontogenic cyst, odontogenic tumors, salivary gland disease tumors, or diseases of skin. There are 4 chapters where histopathological images are usually asked. Odontogenic cysts, odontogenic tumors, salivary gland diseases, diseases of skin. Rarely they can ask you from benign and malignant tumors. So 4 chapters are frequently asked about the histopathological images. For example, they will give an image of ghost cell. Okay, and they'll ask you to diagnose what is this structure or where this structure is seen in which particular cyst, all those things. Okay, so that is the one that is asked. And next, you have the other examples. Like for example, they will show you Zank cells. They'll show an image of suprabasilar split, and within that suprabasilar split, you are going to see Zank cells. So that is again a very commonly asked question. Like I'm giving an example. So they won't ask you any rare. See, ghost cell is again frequently asked question. Zank cells again are frequently asked question. So these are characteristic. For example, pemphigus means Zank cells. Pemphigus means Zank cells, right? So like ghost cells means calcifying epithelial odontogenic cyst. That is odontogenic cyst, they called as Gorlin cyst. So that is what we are supposed to know. So these are some histopathological images they ask you. Then they can ask you even about the clinical images. Clinical images are also very frequently asked. Radiological images, they would have taught you in the radiology part. Okay, oral radiology. But still in oral pathology we have covered radiology also. Particularly not the interpretation part, the radiology, characteristic radiological images. Like for example, I'll give an example. In scleroderma, you have a typical radiographic feature. What is that? Tail of a whale appearance of the mandible. Ramus will have a tail of a whale-like appearance. That is again a very characteristic radiographic image. So they'll ask you that kind of specific images radiologically. Clinically also, it's again a very favorite topic. Again, favorite topics are clinical images. Like clinical images, for example, they'll show you a mucocele. On the lower lip, there will be a mucocele, and it will be blue colored dome shape, they'll ask you to diagnose it. Similarly, they can show you the desquamative gingivitis. That is red gingiva, inflamed gingiva, and then you'll come to know that this is desquamative gingivitis. Okay, so all those things are the frequently asked questions and the concepts you are supposed to know for your now revision course. This is for what I'm telling you is for the revision. For the sake of revision, now what you are going to revise now in the next few days is these are the areas which you are supposed to know. Now let us start one by one with the topics, some of the important topics and some important chapters and topics you need to know. Like developmental disorder, whenever I talk about developmental disorder, I should know about what is a hamartoma and what is a choriostoma. What is a hamartoma and what is a choriostoma? Like what is hamartoma actually? You should know about that. What are the examples you are supposed to know? What are the examples of hamartomas? What are the examples of choriostoma? What is choriostoma? What are the examples of choriostoma? Like example, we know choriostoma is there is a Fordyce's granules. Choriostoma is Fordyce's granules is an example. Okay, so that concept you are supposed to know, right? So then neonatal teeth. Again, what is the natal teeth? What is the neonatal teeth? And what are the what do you understand by Riga-Fett disease? There is an image of that Riga-Fett disease. Okay, where there will be an ulcer on the ventral surface of the tongue in an infant. That you are supposed to know. What is Tugse? All these are some important points that will be asked in the examination. So you should know these are some common things that are frequently asked. Now again, when you talk about the developmental disturbances of the particular structures like tongue, frequently they'll ask on hairy tongue. They'll ask you on geographic tongue. What is geographic tongue? They'll show you an image of geographic tongue. They'll ask you to diagnose it. Or they'll ask you, this geographic tongue has got histopathologic, or this particular disease or this particular condition has histological features similar to that of which of the following skin disorder, like psoriasis. Psoriasis also will have Monroe's abscess. Similarly, geographic tongue also will have Monroe's abscess. Again, that is a very commonly frequently asked question. So geographic tongue. So they can ask you on the image based questions on Epstein pearls and Bohon's nodules. All of us know that there were certain structures, developmental disturbance, that structures that you see it on the palate. So they can give you an image, white nodules. If you see the white nodules along the mid-palatine raphe, what it is. If you see the white nodules at the junction of hard palate and soft palate, what it is. So that kind of questions you can expect in the this one. And Peutz-Jeghers syndrome, again this is a very favorite topic. INICET usually Peutz-Jeghers is very commonly asked. That it is autosomal dominant and you get something called as perioral freckling. Perioral freckling is perioral pigmentation. Okay, so that is what you are supposed to get. Then again, a favorite topic in INICET is cleft lip and cleft palate. So here in cleft lip, cleft palate, the commonly asked thing is about the etiology. What they'll ask you in etiology, what are the genes involved? What is the genetic aspect? What is the genetic aspect that is there? You have the PAX gene, you have MXX1 gene, all those genes that are frequently asked. And what environmental factors are asked? Like smoking, maternal alcoholism, folic acid deficiency, all those things. I'm not going to discuss here, but still that is again a favorite area in case of the cleft lip, cleft palate. Then syndromes, particularly mainly the Van der Waals syndrome is very frequently asked, and Asher syndrome is also very frequently asked. Like what are the genes? Again same, like Van der Waals IRF6, that is the interferon regulatory factor 6 is a gene that is mutated in Van der Waals syndrome. And we know that in Van der Waals syndrome you will see lip pits, lower lip pits. Similarly, you will get the syndromes associated with the various conditions you are supposed to know about that. Like anomalies like Talon's cusp. You have the Rubinstein-Tybee syndrome. Taurodontism. Taurodontism is seen associated with the Klinefelter syndrome. Double lip is associated with the Asher syndrome. Lip pits is associated with Van der Waals syndrome. right? These are the particular syndromes they'll ask you. They will either ask you they will give you an image of the anomaly and they'll ask you the syndrome associated, or they will give you a syndrome and they'll ask you what is the oral manifestation. Melkersen-Rosenthal syndrome again is a very favorite topic, where they'll ask you the triad. It's very simple, very basic. See, it's not that INICET means all questions are tough. It's not like that. Don't think that. Don't have that concept in your mind. Whatever we have revised, whatever you people have learned, which are frequently asked, that will be only asked. There will be some rare questions. Obviously, few questions will be bit tough. Bit tough means what I mean to say, not tough, bit rare. It's rare for everybody. It's rare for everybody. So that should not be your bothering, and you should not think in that way. So your goal should be to answer correctly the most frequently asked questions. So you should not do any mistake in those questions. Okay. Now moving on to benign and malignant tumors. All of us know there are different malignant transformation rates, that is MTR, for different this one. Like for leukoplakia, homogeneous leukoplakia, MTR is different. For erythroplakia, it's different. For nodular leukoplakia, it's different. For OSMF, it is different. For a PVL, proliferative verrucous leukoplakia, it's different. All those lists we have already made. You should know about that malignant transformation rates. And it's not that it is always asked about the malignant, the pre-malignancy or malignancy. Sometimes you get questions on non-pre-malignant but tobacco-related conditions. Like for example, if a person is a smoker, person might have nicotinic stomatitis. On the palate, you might see nicotinic stomatitis, but nicotinic stomatitis is not pre-malignant. Okay, that is what I'm telling you. It is not pre-malignant, but you can get questions on that. You can get images on that. They'll give you they can give you an image on that, and they might ask you what is this, what are the whether it is pre-malignant, not, or all those things that can be asked. Then you have got different types of leukoplakia. That's what we have discussed with the malignant transformation rate, prognosis, and characteristically question on proliferative varicose leukoplakia. Very frequently asked. So you should know in detail about this proliferative varicose leukoplakia. Like what multiple patches will be there, what will be the size of the patch, what is the criteria involved. Okay, women, particularly they are not associated with any kind of habits. All those are the certain types of questions they'll frequently ask you in the benign and malignant tumors. Okay, next you should know about giant cell lesions. Again, a very favorite topic. What is a giant cell lesion? What is the most commonly giant cells are made up? I mean, they are origin. What is the origin of giant cells? That is one topic that is frequently asked. Like giant cells, whenever I talk, giant cells originate from usually the osteoclasts. Giant cells origin from osteoclasts. Okay, so that is again very commonly asked. Now, what are the various giant cell lesions? You are supposed to know what all giant cell lesions will be there. Like what is the giant cell lesion associated in the head and neck, like aneurysmal bone cyst, fibroosseous lesions, like you have the various other lesions, hyperparathyroidism. Okay, all those questions, there is central giant cell carcinoma, peripheral giant cell carcinoma, all those things questions will be asked. Then question is asked on even dysplasia and ploidy. All of us know accurately to diagnose dysplasia, ploidy analysis is very important. And we know that in pre-cancer and cancer, you have aneuploidy. We have aneuploidy. So aneuploidy is again a very characteristic one to diagnose the dysplasia. And you get question on IHC in melanoma, immunohistochemistry in melanoma. So melanomas, usually all of us know there are certain immunohistochemical markers. You're supposed to know about that. HMB45, all those things, markers we're supposed to know. So that is about that's again a very favorite topic. Then HPV, human papilloma virus, is of different types. All of us know. You have the low risk type, you have the high risk type. You are supposed to know the numbers of those. Okay, you are supposed to know the numbers of those, which is associated with the oral pre-cancer and cancer. Like HPV 16, 18 is associated with pre-cancer and cancer. That is what you are supposed to understand. And then basal cell carcinoma. So again, that's very frequently asked. What are the types of basal cell carcinoma? Which is the aggressive type? and all those things are you're supposed to know about that. Okay, so that's all things we have covered, but I'm just giving you an overview how you are supposed to, what are you supposed to know about that. Like OSMF, whenever is asked in the INICET, usually the question revolves around the pathogenesis. You're supposed to know about the enzyme lysyl oxidase, what metal is associated with the lysyl oxidase, what is the function of lysyl oxidase, what happens to collagenase enzyme in OSMF. That is what you are supposed to know about the OSMF. And you also get the questions on the syndromes associated with the hemangiomas. Like Sturge-Weber and Rendo-Osler-Weber is again very, either of the two frequently comes. Like all of us know, in Sturge-Weber syndrome, there is unilateral hemangioma of the palate or face. Okay, Rendo-Osler-Weber syndrome, we have telangiectasia of the lips. All those things are the frequently asked questions. And MNET, there is melanotrophic neuroectodermal tumor is asked. Ann Arbor staging is commonly asked in lymphomas. What is it? Usually, you should know that Ann Arbor staging is both types for both type of lymphoma. For Hodgkin's also, for non-Hodgkin's also. We are supposed to know the various stages, stage 1, 2, 3, 4 in the Ann Arbor stage. Okay, that is about the benign malignant tumors. Then question comes on odontogenic cysts and tumors. Whenever a question comes on odontogenic cysts and tumors, particularly the OKC, that is odontogenic keratocyst, you get questions on the recurrence. OKC usually question comes on recurrence. What is the recurrence rate? How much is the recurrence rate? What is the main reason for the high recurrence rate in OKC? That is a question that is usually asked in case of odontogenic cysts. And whenever we talk about AOT, that is adenomatoid odontogenic tumor, all of us know the speciality of AOT, that this AOT is not a neoplasm, it is a hamartoma. So that is again one concept usually they ask about. And the location of the AOT and what is the gender, more commonly they will have this AOT, that is what you are supposed to know. And then COC again, that is calcifying odontogenic cyst, you're supposed to know about its location. Its location is very unique because it is again associated with the anterior maxilla. And importance of this COC is that it has got mixed radiolucency and radio opacity. Histologically, it will show presence of ghost cells. All of we have already discussed where do you see ghost cells. So you should know about the ghost cells. Image of the ghost cell, and what are the conditions where all you will see ghost cells. That is the question. That is the type of question they'll ask you. Then amyloblastoma. Talking about amyloblastoma, which is the second most common odontogenic tumor, there usually question comes on the histopathology. So when I talk about histopathology, the third one is most important here. That is Vickers-Corlin criteria. All of us should know about this Vickers-Corlin criteria. What is that criteria? What are the 3 points in this criteria? What is the image you are supposed to remember? Okay. Then we are supposed to know about the types. What are the types of amyloblastoma? Like follicular is there, acanthomatous is there, plexiform is there, okay, granular cell is there. All those types of amyloblastoma we are supposed to know. Which is the most recurrent type? Which is the most common aggressive type? All those things questions you are supposed to know. And then specifically question comes on granular cell amyloblastoma. That it is a very aggressive type. Granules are lysosomes, all those things. Okay. And there is another odontogenic tumor where again frequently question comes is on cementoblastoma. All of cementoblastoma typically has got the roots where there is a radio opaque mass attached at the tip of the root. So that is again a very commonly asked frequent question about the cementoblastoma. Radiographic images is there, and it has got a very unique clinical feature also. Like cementoblastoma, there is the only odontogenic tumor where the patient complains with pain. Usually odontogenic tumors will not have pain. Cementoblastoma is the one where typically young individuals who comes with the pain, and you take a radiograph, you see that in the periapical region there is a radio-opaque mass attached. That is a very frequently, or you can say, the characteristic of cementoblastoma. And moving on to the Pindberg tumor, that is CEOT, calcifying epithelial odontogenic tumor, we are supposed to know about the stains, special stains, particularly for the amyloid. So we know that there is amyloid deposition. There is amyloid deposition, and amyloid can be demonstrated actually by which special stain? By which special stain? Like Congo red stain will give which color? That is what you are supposed to know about in case of the Pindberg tumor or calcifying epithelial odontogenic tumor. Okay. Now, next, moving on to salivary gland tumor. What is asked in salivary glands? Salivary glands, if you see, first thing that you are supposed to know about salivary glands is about the pleomorphic adenoma. Whenever I talk about pleomorphic adenoma, I am supposed to know about the myoepithelial cells. Myoepithelial cells. So frequently question comes on myoepithelial cells. What are the various shapes of myoepithelial cells? Okay. And what is the interaction between myoepithelial cell and ductal epithelial cell? That is what I've written down here. Melting type of growth pattern. That is very frequently asked. Okay, swarm of bees or melting type of growth pattern in case of the pleomorphic adenoma. And chondromyxoid stroma. Don't forget this. This is a very commonly asked question. Chondromyxoid stroma is seen in pleomorphic adenoma. Okay. And histology of a clinical feature of pleomorphic adenoma is also very commonly asked. Like all of us know, pleomorphic adenoma affects the parotid gland most commonly. Okay. Usually it will slowly growing. It will be painless. It will be easily movable. It is firm. Okay. It is firm. There is no kind of any nerve involvement here. All these things are frequently asked in case of frequently the clinical features of the pleomorphic adenoma. Then when you should know about others, not that you should not know about the other salivary gland tumors. Question can come on Warthin's tumor. But again, question comes on the adenoid cystic carcinoma versus PLGA. So we have made a table. Please go through that table. That table is very commonly asked, like ACC versus PLGA, adenoid cystic carcinoma versus polymorphous low-grade adenocarcinoma. You should know about that differences. What are the differences between the two? And you should know about the perineural invasion. What is perineural invasion? Which are the salivary gland tumors which can show perineural invasion? Okay, so that is what you are supposed to know about in case of salivary glands. Now let us move on to the non-neoplastic salivary gland lesions. When I talk about non-neoplastic salivary gland lesions, typically question can come on the mucocele. That is what I've discussed when I told you starting. Location based, that is a lower lip, dome shaped, blue colored, all those things that will be asked. And again, a characteristic lesion on the palate, that is necrotizing xylometaplasia, which will show a crater like depression, large crater like ulcer with a male smoker. That is what we could be asked. Sjogren syndrome question usually comes on its laboratory diagnosis part, particularly the lip biopsy. You are supposed to know about the lip biopsy in case of Sjogren syndrome. That is focus, as we have discussed that whenever you do a lip biopsy, there should be more than one foci of lymphocytes per 4 mm square area. If I take a 4 mm square area, there should be more than one foci. What is one foci is equal to? One foci is equal to 50 lymphocytes. One foci is equal to 50 lymphocytes. Okay, next question can come on silidinosis. Silidinosis is also known as silosis. What is silidinosis or what is silosis? You are supposed to know about that. What are the various conditions? What are the various conditions associated with the silidinosis or silosis? You should know about the different conditions and what are the what is the Kuttner's tumor? Again, very favorably asked. Kuttner's tumor. Kuttner's tumor. What is Kuttner's tumor? where what is the important clinical feature of pulmonary tumor, and xerostomia. Xerostomia is again a very favorite topic. Usually question comes on treatment part, particularly pilocarpine is a very commonly asked question. You're supposed to know. There are many things. I'm not telling that it's only in xerostomia, they'll ask you only about pilocarpine. So these are some characteristic questions that can be asked, like what is the dose of pilocarpine? 0.5 to 1 mg that is used in case of treatment of xerostomia. Okay. Now, when I talk about diseases of nerves, what are the topics you are supposed to definitely know? Revise is the clinical features of trigeminal neuralgia. The Sweet's criteria. All of us know there's something called as Sweet's criteria, right? White and sweet. What is white and Sweet's criteria? So you're supposed to know about what is this Sweet's criteria in case of trigeminal neuralgia. You can get even questions on treatment aspect of trigeminal neuralgia, medical management. When I'm talking about treatment, I'm talking about medical management. You should know the role of carbamazepine. You should know the role of baclofen. What are the important adverse effects of carbamazepine is also frequently asked. Aplastic anemia or the bone marrow depression or bone marrow suppression is again a very favorite, commonly asked question. And then alarm clock headache about the spinopalatine neuralgia. I'm supposed to know about the spinopalatine neuralgia, which is also known as alarm clock headache. What are the clinical features? Why do you call it as alarm clock headache? Do you see any trigger zones here in case of the alarm clock headache? That is again very commonly asked question. Okay, and then you're supposed to know about traumatic myositis ossificans, which is also known as petrified man syndrome, and then about Eagle syndrome. What is the etiology of Eagle syndrome? Why do you see Eagle syndrome? And what are the important clinical features of Eagle syndrome? How are you going to differentiate Eagle syndrome from glossopharyngeal neuralgia? See, glossopharyngeal neuralgia and Eagle syndrome patients have got similar clinical features. You should know the difference, which we have discussed. Okay, so that is related to the mouth opening. All of us know it's related to mouth opening. So we should know that difference also as far as the Eagle syndrome versus glossopharyngeal neuralgia is concerned. Okay. Then after that, topic on the skin diseases. Skin diseases, it's a very vast topic. Usually question comes on the pemphigus vulgaris. When we are discuss about pemphigus vulgaris, so it's not DOF, it's DIF. Direct immunofluorescence finding is again very favorite, commonly asked question. Then they can ask you a question on pulse therapy. Pulse therapy in pemphigus again is very favorite. What are the various regimens of pulse therapy? We know that there are some different regimens like DCP therapy, DAP therapy. All those pulse therapy regimens we are supposed to know. Then in pemphigus, histopathology is very important. What is the level of split? We should know that it is an intraepithelial or suprabasilar split is seen. What are the various cells that you see in case of pemphigus? All those things question will be asked. And you are supposed to remember the list of conditions where you will see intraepithelial split, where you will see subepithelial split. For example, pemphigoid will have subepithelial. Pemphigus will have intraepithelial. Okay, broadly I'm telling you, you're supposed to know that what are the various this one which will have different split. And then you're supposed to know about the lichen planus. Lichen planus, we are supposed to know about the Wickham's striae, types of lichen planus, which is a pre-malignant condition, which is associated with desquamative gingivitis, and we should know even about the histology or histopathology of the lichen planus also, like subepithelial lymphocytic infiltration. All those things questions are very frequently asked in case of skin diseases. And scleroderma, as I've already discussed, scleroderma OPG is very favorite. This has come in INICET, AIIMS paper also previously. It has come even in the NEET paper also. So scleroderma, you should know about its IOPA also. All of us know what we are supposed to know in IOPA. It will show the skin disorder which shows whitening of periodontal ligament. That is scleroderma. And even scleroderma will show the ramus, which will be narrow like a tail of a whale appearance. Moving on to the infections When I talk about infections, first bacterial infections, you can get questions on actinomycosis. Particularly when I talk about actinomycosis, on they'll show you a clinical image on the mandible. There will be multiple draining sinuses, and through those draining sinuses you can see pus, and in that pus there will be sulfur granules. So you can get question on sulfur granule. What is sulfur granule? What is ray fungus? Multiple draining sinuses, all those things, questions that can come on actinomycosis. And syphilis, typically you're supposed to know about the oral manifestation of different stages of syphilis. Like chancre, you should know about mucus patches, you should know about the gamma, you should know about Hutchinson's triad, all those things. And you are supposed to know about the syphilis again, the diagnosis is also very commonly asked. So particularly they'll ask you about the which type of microscopy you use to diagnose syphilis, like dark field microscopy. You're supposed to know about that particular type of mind. And what is a special stain to diagnose the spirochetes? That is a silver stain is used. All those questions are also very commonly asked in case of syphilis. And moving on to the viral infections, you get questions on the herpes simplex. What are the various types of herpes? The primary, secondary, okay. And then you're supposed to know about the Lipschutz bodies, that is intranuclear inclusion bodies that you see in case of HSV. You get even questions on the histopathology of the HSV. And again, there is one commonly asked question in case of HSV, that is geometric stomatitis. Geometric stomatitis. What is this geometric stomatitis? In HSV, herpes simplex virus infection, particularly in HIV or AIDS patient, you have the stomatitis that is seen as a patchy areas within the oral cavity. That is called as geometric stomatitis. That is again very frequently asked. And measles again is very commonly asked. Like we are supposed to know, in measles, particularly in the buccal mucosa, there will be Koplik spots, blue colored spots. That is asked. And usually question comes on the relation between the skin and the Koplik spots, that time duration, whether Koplik spots will appear first, how many hours before, how many days before. That is what is usually asked. And moving on to the herpangina. Herpangina, commonly asked question is its clinical feature. What is the speciality of herpangina? Herpangina typically affects posterior palate. Anterior part of the oral cavity is totally normal in case of herpangina. Okay. And you get questions on its etiology, that is Coxsackie virus. And candida, particularly you should know types of candida, you should know Newton's classification for the particularly the denture stomatitis. Newton's classification is there. And you should know about different types of candidiasis, that is oral thrush, acute atrophic, chronic hypertrophic, all those types of candidiasis you are supposed to know. Coming on to the mucormycosis, aspergillosis. These are again very favorite topic. Why? Clinically both look similar. There is a difference in the underlying condition. Like mucormycosis is seen in uncontrolled diabetes patients. If a diabetes patient is there whose sugar level is not controlled, they are at a high risk to develop fungal infection, that is mucormycosis. If a patient is immunocompromised, that is HIV positive patient, their chances of aspergillosis is more. How to differentiate between the two? Histopathology is very commonly asked. That is septate. We have discussed in detail which are the septated hyphae, which are non-septated hyphae. Okay, all that are the questions that are frequently asked. Okay. Okay. Next, metabolic disorders. What are we supposed to know about metabolic disorders? Particularly hypophosphatasia. All of us know what is hypophosphatasia. You should know about its clinical features, how there is premature exfoliation of the teeth that takes place in case of the hypophosphatasia. You're supposed to know about that. You're supposed to know about the Brown's tumor. What is Brown's tumor? Hyperparathyroidism. Why do you call Brown's syndrome tumor? What is that pigment? Okay. You should know about particularly the Hurler syndrome. Hurler syndrome, particularly the oral features. That is the oral cavity manifestations are very commonly asked. Sarcoidosis, oral features are asked. And Hereford syndrome. All of us know there's something called as uveoparotid syndrome or uveoparotid fever. That is Hereford fever, Hereford syndrome. That is also very commonly asked. Okay. Forensic odontology, you can get questions on age estimation methods. Concentrate on particularly the Nola's method, Demerijan method, or Gustafson's method. Questions can, particularly Nola's method it comes in even pedodontics also, and it is taught in oral pathology also. But you can get question on Nola's method, and then Gustafson's method. Particularly Gustafson's method is very frequently asked here, and you should know about what is the bite mark, what are the basically types of bite mark, what is the classification. You should know about the classification of bite marks, and lip prints, types of lip prints, classification of lip prints, and what particular impression material you use for bite marks. All those things you're supposed to know. Okay. Next, you are supposed to in bone diseases. I'm not going. Bone disease very vast, very wide. It's a very big chapter, but still, question comes on osteogenesis imperfecta. Osteogenesis imperfecta, particularly the pathogenesis part, where the collagen is involved. Okay, they'll ask you on what is the main etiology for this osteogenesis imperfecta. That is the collagen maturation. They'll ask you questions on that. What gene is involved? And particularly genes associated with fibrous dysplasia, cherubism, osteogenesis imperfecta. You're supposed to know these common syndromes as Krausen-Appert, Treacher-Collins syndrome, and Paget's disease. You're supposed to know about that it has got a highest alkaline phosphatase level. What is its level? You're supposed to know. What is a Lincoln sign? All those things are very commonly asked in case of bone diseases. Moving on to the last in miscellaneous, some important pigmentation is also very frequent. See, I can't cover entire oral pathology in 1 hour. What will be asked in I am giving you important highlight topics which we are supposed to revise. Like you are supposed to know what is plumbism, what metal poisoning will cause plumbism, what is Burton's line, what is acrodynia, what is rose petal appearance, what is argyria, what is silver poisoning, what is tetracycline staining, till what year I am supposed to a child that should not consume, should not be given or prescribed tetracycline. What is the typical fluorescent microscopic finding of tetracycline? When you apply UV light, there will be yellow fluorescence that you see in case of the tetracycline stain. All those are some of these whatever I have told you are the commonly or frequently asked questions for the INICET paper. Okay. So all the best for your preparation. Stay cool, stay calm. Don't read anything which is new. Just revise the things which you have already learned. Okay, and stay confident. That's most important. See, whenever you are going for any of these competitive examination, so you should be confident on your preparation. Read the question twice before marking the answer. Marking the answer will take just 10 seconds. Okay, but reading the question, analyzing the options, what among the options which is the best. All of us know by this time that out of 4 options, 2 will have similar chances. So among the 2, which is the best option I need to choose? So always think from an examiner point of view. What the examiner might think, what he is expecting. So think in that way, give your best. Okay, and all the best. Any doubts you can ask me in the chat box. I'll answer that. Otherwise, we'll close the session here. Okay, all the best. Thank you so much.